Welcome back to Sleep Better TV. I'm Scott Drake, and I'd like you to welcome my guest, Dr. Mark Levy, DDS, who practices dentistry in Columbus, Ohio. And among his area of practice is treating sleep-breathing disorders. Mark, welcome. What exactly is sleep apnea?
Sleep apnea is a condition where the patient, the victim, literally stops breathing a certain number of times during the night or gets to the point where the oxygen level in their system goes so low that they get to a dangerous condition, dangerous state.
Dr. Levy, can you talk about some of the causes of sleep apnea?
It's more often than not the relaxation of the tongue and the muscles in the neck. And when you're asleep, your tongue relaxes and lies back and literally blocks off the airway.
Well, doctor, we read every day about some new problem associated with sleep apnea. As a matter of fact, NFL player Reggie White apparently died from it. How dangerous is it?
That's a great example, if there could be a great example. The reality is that when someone stops breathing X number of times a night, and it can be up to, I've seen over 100 times per hour, if you can believe that, they stop breathing. Every time they come out of that non-breathing event, their blood pressure shoots up and their pulse shoots up. It's sort of a fight and flight reaction. So if your blood pressure and pulse shoots up 10, 20, 30, 50, 100 times an hour, eventually something's going to give, something's going to blow. I mean, unfortunately, we've all heard of other people who have died in their sleep of a heart attack or a stroke. Now, wouldn't you think that while someone is sleeping, that's the time that they're most relaxed? That's when they're calmest, their systems are relaxed and recuperating. In reality, someone with sleep apnea, every 2, 3, 4, 5 minutes, they could stop breathing and have a fight or flight reaction. Something gives, and that's what kills you.
And typically, how is sleep apnea treated?
Well, there are 3 ways to treat it, and no other ways, other than losing a gross amount of weight. One is with a CPAP machine or BiPAP machine. They're pretty much similar. What those do with the mask, they force so much air through your nose that it literally pushes your tongue out of the way, opens up the airway, and forces air into your lungs, unfortunately also into your stomach sometimes. The second is surgery, where they create more room. I mean, the way I like to describe it is most patients with sleep apnea, if they consider their tongue as a car and the inside of their mouth, the back of their throat, their garage, they literally don't have enough space to park their car. So the options become, we can give you a smaller car, and they literally reduce the size of the tongue. They can create a larger garage where they remove tissues in the back of your throat or bring both of your jaws forward to give you a larger garage. And in extreme examples, and we don't see it very often, but sometimes people actually have to go to the point where they have a tracheotomy done, open up the airway below the obstacles, and have a direct line so they could breathe. Unfortunately, there are other problems associated with that. No one really wants that, obviously. But those are the first 2. Those are the ones that people hear about most. Unfortunately, most people don't hear about what dentists can do. The dentist solution is a device, it's an oral device. It looks very similar to an athletic mouth guard or sports safety device. And what it does, it holds your jaw in a very specific position. Your tongue is actually attached to your lower jaw, so if we can bring your jaw forward, your tongue comes with it, and it simply opens up the airway in the back.
All right, Dr. Levy, thank you.
Thank you.
My guest has been Dr. Mark Levy, DDS, who practices in Columbus, Ohio, and this is Sleep Better TV.